Producing solid foods will not help your baby sleep better at night. And yet, if you put them to sleep with a stomach full of a new food that they have to work through their GI tract, it can make them a little bit squirmy or uncomfortable. I would give any new foods early in the day, and I would certainly not feed within an hour or two of bedtime. Um, so I hope those are helpful information on solids. I will do a whole week on solid food sometime in the coming weeks. All right, so now we're going to talk about our topic of the day, which is milk supplies. I'm going to go to the beginning of my deck here for that. You got a little sneak preview there. Okay. All right, so thinking a little bit about milk supply, I want to talk about really thinking about the basics. A lot of people with newborns are concerned whether or not they're producing enough milk and whether or not the baby is getting enough milk. So starting with the basics during the first 1 to 2 weeks, is the baby peeing, pooping, and gaining weight? And then usually when I'm assessing how is breastfeeding going for a mom who's got a baby under a month old, typically the questions I ask are, is your baby peeing, pooping, gaining weight, and are your nipples comfortable? So here we're talking about weight gain. I certainly hope that mom's nipples are comfortable. But is the baby peeing, pooping, and gaining weight? Because normal newborn behavior, which we're going to talk about in a minute, is so overwhelming and exhausting to new parents that it's easy to misinterpret what is a normal newborn behavior as a sign of hunger or a sign that the baby is not getting enough milk. When it comes to weight gain assessment during the early weeks, these numbers I put up are a good ballpark. Of course, there's going to be a wide variation, but just as a ballpark measurement, to think about a baby gaining ½ ounce to an ounce a day, which equals roughly 1/4 pound to ½ pound a week, which equals roughly 1 to 2 pounds a month. It's also important to remember that we measure from the baby's lowest weight. Now, because I've been doing this for a good 20 years or so, and I've seen a lot of babies, and I can do a lot of these, kind of calculations without really thinking about the numbers in my head. A lot of times, if I see a baby who's a month old, I'll just ask, what's the baby's birth weight and their current weight, because I know that typically a baby is going to lose 10% or so sometimes of their birth weight, could be about ½ pound or so. So if a baby starts off at 7.5 pounds at birth, I know that the baby probably went down to roughly 7 pounds or 612 or something like that before they started gaining. And we really want to measure from the lowest weight gain as opposed to the birth weight. But these numbers can all kind of blur together when you get to a baby that's 6 weeks, 8 weeks, 10 weeks old. So a good rule of thumb is is the baby roughly gaining at least 1 pound a month? 1 to 2 pounds a month is kind of going on track. Breastfed babies, if they're exclusively breastfeeding at the breast, the diapers are a great indicator of how things are going during the first few weeks. Sometime after 1 to 2 months, not all, but many breastfed babies will change their stooling patterns. And so early on, we'll say, tell me about their poopy diapers. But after 6 or 8 weeks, some babies will continue to poop 2 or 3 times a day, and some babies will poop once or twice a week, and both are normal patterns. So if your baby is only pooping once or twice a week and they're a month or 2 or 3 old, if they're exclusively breastfed, that is not a sign that they're not getting enough milk. The question I would like to know is, are they continuing to wet big, heavy diapers every day? 5 or 6 very heavy disposable diapers a day, or 8 or 10 cloth diapers, wet diapers a day. So you don't go by bowel movement after that point. Normal newborn behaviors are hardest between weeks 4 to 8, in my opinion, because young babies, I love them dearly, but they essentially do 3 things. They eat, they sleep, and they fuss. I say that with love. It doesn't mean that they fuss all the time, but it does mean that if they're not eating and then they're not sleeping, you're actively involved in keeping them happy. Fortunately, it doesn't take a whole lot to keep them happy. Usually wearing them in some kind of sling or carrier, letting them suck on your breast or your finger, or a pacifier if you're choosing to use that. Using vestibular motion, rhythmic motion is useful. So most of the time you can calm or lull a baby when they're awake, not always, but most of the time. But these are very normal newborn behaviors that often moms or parents will interpret as something wrong. This can't be normal for a baby, that the baby wants to nurse or suck all the time, will sleep beautifully at the breast or when held, but as soon as you're sure the baby's asleep and try to put them down in a bassinet or the crib, the baby wakes right up and cries, or within a few minutes, 45 minutes, is rustling wide awake and screaming until you put them to the breast, where quickly they will fall right back to sleep. Cluster feeding, so wanting to eat at 6 p.m., 7 p.m., 8:30, 9:45, where you can't even imagine there's another drop of milk there, and the baby is nursing and dozing, but every time you try to take them off the breast and pass them off, or take them off the breast and put them down, they get frenzied again. No, 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 I wasn't done. So certainly that's got to be a sign that there's not enough milk there, right? Wrong. And then waking frequently at night to eat. So, that sort of every 90-minute awake time at night. And all of those, shockingly and exhaustingly, are very normal newborn behaviors. And I think, coming into a group where you can find other moms who have babies exactly the same age, because that's really key. Even talking to a mom whose baby is 3 or 4 or 5 months older can be supportive, but it's really hard for them to remember exactly what it's like at 5 weeks. And these are all the tips that we teach in week 1 of Great Beginnings here in the Boston area. Vestibular motion, which is rhythmic motion, and I got to tell you, those physio balls, like you see in the back of the picture, the blue physio ball, sitting on the ball and getting gentle rhythmic bouncing going is awesome for lulling. The tummy massage for gas, because probably about 99% of new moms would say that their baby is gassier than the average new baby. And if you think about that math, it just doesn't work. Babies are gassy, and more importantly, they're very dramatic about their GI tract. They turn bright red and scream. They turn, whitish and strain, and they grunt and strain and grunt and toot until finally, after 20 minutes, they pass a fart or bowel movement. They can have explosive bowel movements that come shooting out at high velocity and hit the wall. And all of this, shockingly, is normal for newborn babies. So learning tummy massage and specific holds that are comfortable and ease any tummy discomforts is helpful. Learning how to use a sling or carrier, because babies are close contact species and they want to be held and moved constantly, just like they were in utero. So if you can figure out how to use a sling or carrier and have your hand free and your baby content, it is just a win-win for everybody. And then here at ISIS, the super swaddle technique is a favorite, and this is something that helps babies once you get the feeding thing going. If your goal is to have your baby sleep for a couple of hours on their back in a co-sleeper or in a bassinet during the day or something like that, some swaddle techniques can really be helpful. You see, I make a list of these helpful breastfeeding support items that really have nothing to do with breastfeeding at all. And that's my point, is that normal newborn behavior can be misinterpreted as there's something wrong with my baby, there's something wrong with my milk, there's something in my milk that's bothering my baby, there's something wrong with my supply, or there's something wrong with my parenting and the way I'm doing things, because this can't be normal. And to be in a group with 8 other moms who have babies in that exact same time frame and hearing their stories and realizing you're not the only one who is spending your day holding your baby while she's sleeping, holding your baby while she's feeding, and walking your baby and changing your baby's position every 5 minutes so that he or she remains content, is how most of the other moms who have babies between 4 and 8 weeks are also spending their time. And it's hard in the moment to embrace the idea that this too shall pass, but it's a very hard time frame. It's a very special time, and it's a time where moms need a lot of support, and that's the time where they're less likely to get it, because partners go back to work, the UPS truck stops coming every day, friends and family stop dropping in and visiting all the time, moms become more socially isolated, and the baby begins to wake up and spend more time awake. And again, when they're awake, they're not particularly happy. If you think of those 3 things, feeding, sleeping, and fussing, if they're not feeding and they're not sleeping, they're either fussing or you're actively involved in keeping them them happy. They just don't have many hobbies at that age. So these are all things that don't directly relate to breastfeeding, but relate to the infant's temperament and your survival tactics. Continuous white noise machine, a good swaddling technique, using vestibular motion. I wish the ball came with a vestibular motion holder like this guy. So I hope that you have a friend or family member or partner who can give you a break as well and do some baby lulling. Getting out. So isolation really is extra devastating for a new mom and a cranky baby between that 3 to 10 week time frame. You got to get out every day, and in particular, if you can be out sometime between 9 and 1 in the morning, and let that sunlight hit your baby's face, even if their eyes are closed. Let that sunlight hit your baby's face, and it does help their melatonin and their serotonin levels, and it does begin to regulate their day-night cycles. Even if they're asleep, their brain still feels and senses that light. So whether you're going for a ride in the car or you're going for a walk in the stroller, you got to get out every day. And I prefer that to be an outing that involves social interaction, more so than the guy getting your prescription at CVS. That's a very brief social interaction. So how can perceived low milk supply become a self-fulfilling prophecy? Well, so say in the evening the baby's cluster feeding and fussing, you're exhausted, the baby's frenzied, and so at your wit's end you offer the bottle, and the baby takes it, and then seems reasonably relaxed. And so the next night or the night after that, you begin to get in this cycle where you're breastfeeding and then you offer a bottle and the baby takes it. And the baby begins to take more bottles after breastfeeding and begins then to actually become sometimes fussier at the breast, because as we were talking about at the very beginning of the webinar today, a baby can get accustomed to the immediacy of the milk flow from the bottle. So the hard, firm bottle nipple goes in the baby's mouth. The baby moves their tongue or their lip or their gum, and the milk flows into their mouth, and they basically lay there and receive it. And you can see there's two examples here of the bottle just, easily releasing milk, and the baby just lying at the end of a cascading waterfall and reaping the benefits, and then is faced with the breast and says, wait a minute, I have to wait, there's nothing coming out. They have to work a little bit harder at the breast. They cry at the breast, which makes mom cry too, and somebody says give the baby a bottle, so they give the baby a bottle, and that's what the baby wanted, and the baby stops crying. So how do you end up not in this downward spiral? The other issue with supplementing or topping off after breastfeeding, if you're not doing anything to address any supply issues, is that it does begin to be a self-fulfilling prophecy of low supply, because the more milk the baby is getting from an outside source, whether it's formula or it's milk that you expressed many days ago from the freezer, the less message is sent to your brain to increase milk production. So whether the baby is getting breast milk or something other than breast milk, if your body doesn't know that more milk is being asked for, that your body is not going to rise to the occasion, and that makes the baby even more frustrated at the breast when the milk supply is then less abundant. So most causes of low milk supply begin one way or another with inadequate milk removal. And here is my 8-ball. So what the heck does the 8-ball have to do with milk removal? Well, thorough, frequent breast emptying. I put the word emptying in parentheses here because a lactating breast is never fully empty. It's more like a leaky faucet. So I don't really like the image or the message of emptying a breast. I prefer to say the breast is well fed on or well drained. But for easy semantics, thorough and frequent breast emptying. And we're going to talk more about this in depth. And breastfeeding early and often. What happens during the first 2 weeks are critical in terms of establishing and then maintaining a strong milk production. If a baby is born at 32 weeks, and that happens, if a baby has a medical issue and that is keeping the mom and baby separated or preventing the baby from breastfeeding, and that happens, there are many reasons why the baby is not at the breast and emptying the breast thoroughly during the early days. But one way or another, mom needs to stimulate and then maintain milk production, whether it's by the baby or manual expression or a breast pump, early and often. Frequent and thorough breast emptying is what is going to initiate and then maintain milk production. There's no way around it. And the research supports a minimum of 8 times in 24 hours. So I'm using 8 as the magic number here. If a mom said, I have a preemie, she's not nursing, I need to exclusively pump for the time being, 8 times in 24 hours. That's roughly every 3 hours, every 2 to 3 hours during the day, and every 3 to 4 hours at night. That adds up to 8 times in 24 hours. So here are the quick, secret, down and dirty tricks or cheats to make more milk. Okay, did you hear them? Yeah, right, because there really aren't any. It really goes back to what we just talked about. Frequent and thorough breast emptying. That's what makes milk. There are no secret tricks or treats to make more milk. I can teach you some tricks and shortcuts to expressing milk or to positioning a baby more effectively. But when push comes to shove, it's all about stimulating production and removing that milk. You got to move it to make it. You got to use it or lose it. That's the way it goes. So here are a variety of reasons why milk may not be removed in the early days when it really needs to be. And the issues, it can be a little bit, there's blurry lines, but it can be more on the mom side of things or on the baby side of things. It really doesn't matter why the milk is not being thoroughly and frequently removed from the breast. The end results are going to be the same. If you do not move the milk from the breast early and often, thoroughly and frequently, approximately 8 times in 24 hours, it will eventually affect milk production. So here's some of my analogies. There's an engorged breast. It doesn't look hugely engorged to me, but there you have it. And what I want you to see is the lobes, which are the things toward the back of the breast where the milk is kind of made and hangs out until it's released. And the more distended those become with milk that's sitting there, the more of a feedback loop is sent to the brain saying, slow down production, we're full up here and we don't need to make more. So here's my conveyor belt with the brown boxes on it. I want you to imagine that conveyor belt moving and the boxes one by one being emptied into a pile at the end. And imagine that pile is getting bigger and bigger until it actually jams up or stops the production, the conveyor belt from moving. So the milk is being made like those boxes, and it's moving down the conveyor belt. And when there's so much at the end that the conveyor belt really has nowhere to go, it just stops. And that's what's going to happen. If you sit around with your breasts full of milk too often, too long, it sends a message to your brain that says, stop, just stop. There's enough, just stop. And that's what gradually ends up happening. And then on the other side of things, we'll talk more about this in just a minute, increasing the ask. Earlier, I mentioned a lactating breast is never completely full or completely empty. There's always another drop and another drop, like a leaky faucet. And here you see the picture of a leaky faucet. The best way to make more milk is to increase the ask, to ask your breast to eke out another drop and another drop and another drop of milk than it has readily available. That sends the reverse message to the brain: more milk is being asked for than I have handy, so please make more. Okay, we'll talk about these in more detail. Here are some things on the baby side which may lead to lower milk production. And again, most of these have to do with the inability to thoroughly empty the breast on a regular basis, about 8 or more times in 24 hours. When a baby is jaundiced, this becomes a cycle, a downward spiral cycle, because jaundice can be a sign of not getting enough milk. It doesn't have to be. Certain ethnic groups are far more likely to have higher rates of jaundice, and it's normal, and some amount of jaundice is very normal, and so on. But it can be a sign of low milk intake. And jaundice makes the baby very sleepy. And a sleepy baby, as you know, is harder to feed at the breast. Also, a sleepy baby sleeps, and moms are exhausted. And so when the baby is sleeping and not demanding to be fed during the day, it's easy to let the baby sleep. And it's hard, even though maybe you're told to wake the baby and feed the baby does not feed well at the breast because they're so sleepy. So then they get more jaundiced. So again, it's a cycle that feeds onto itself. Sleepy baby not feeding well, jaundiced, so they're sleepier, so they're not feeding even more well, and then they're jaundiced even more, and so on. On the other side, on the right side, I was trying to use that picture to indicate a poor latch. So mom may be putting the baby to the breast 10 times in 24 hours, but if the baby is not latched well or is not transferring milk well from the breast, despite the fact that the baby is at the breast for an hour, every other hour throughout the 24-hour period, if the milk is not being transferred and the breast is not being thoroughly emptied, then milk supply will be impacted, as well as the baby's intake. Going clockwise now, a baby with a tongue tie, so oral anatomy can impact whether or not the baby can latch or latch effectively. A baby that is born early or preterm or has medical issues may not be ready or able to breastfeed directly at the breast. And then for an older baby who is starting to sleep longer at night, that may have an impact on mom's production as well. If the baby is starting to go a 10-hour stretch at night, I know it sounds like heaven. If mom is going 10 hours, 11 hours between breastfeeding or pumping, it may have a negative impact on her supply. Okay, and here's some common mom issues which can lead to lower milk production. Again, anything that prevents thorough milk removal 8 or more times in 24 hours. So our pumpkin lady here is demonstrating engorgement, especially in the early days. Many people have heard, how many of you have heard, if you're engorged, don't pump, or you'll just make the situation worse. You'll just encourage more milk to come. Well, long term, that's true. You can create a situation of oversupply by pumping when engorged, and then pumping again, and then pumping again, and kind of perpetuating oversupply. And that's going to be our topic next week, is oversupply and overactive letdown and fore milk, hind milk concerns. But in general, engorgement, sometimes pumping is appropriate when moms are engorged. Having rock hard breasts is both painful, dangerous, and not helpful for the baby either. The other thing I will mention, if we're talking about day 4, day 5, after the baby is born, rock hard engorgement is not the breasts full of milk. There's a lot of interstitial fluid and edema that swells the breasts up, and particular moms who had a lot of IV fluid during childbirth, I noticed, their legs become very, very swollen with all that IV fluid, and then 2 days later, half of that IV fluid is sitting in mom's breasts. So, a lot of times moms will wonder why their breasts are so hard, engorged, and firm, and yet they pump and they're only, getting an ounce of milk out, whereas the 8 or 10 ounces of milk that feel like are in the breasts. So part of it is milk, part of it is increased blood flow, and that leads to edema and swelling of the breast tissue. But unresolved overfullness over time will have a very negative impact on milk production. Remember, back to that conveyor belt analogy, it simply tells the brain, stop making milk. The breasts are full up here, stop. Moving clockwise, pacifier, so a baby who's busy sucking on a pacifier, lots and lots during the early weeks, instead of spending time at the breast nursing, will have less time at the breast, less stimulation to the breast, less milk removal, and that could have a negative impact on mom's production. Picture down below that is intended to show breast pain or nipple pain. So sometimes if moms have cracked or painful, damaged nipples, breastfeeding is so uncomfortable, moms dread the next feeding and try to put it off either by lulling the baby, or by giving the baby a pacifier, or maybe by giving the baby a bottle, because it freaking hurts to breastfeed. That's That's not pleasant. When your nipple hurts, it really hurts to breastfeed. And so it seems natural that a mom would try to, put it off as little as possible. But again, that will have a negative impact on production. And if you do have nipple damage and it makes you dread the next feeding, please get help. We would love to see you in person. If you're not in the Boston area, then find an IBCLC that has, a lot of experience and good references behind her. And sometimes a combination of expressing, doing some things to heal the nipples first, working on the latch, and so on. We'll get the nipples healed, we'll get the baby back to breast, we'll maintain your milk production. And then continuing clockwise, remember earlier I was saying if the baby sleeps longer, if mom is sleeping, so maybe someone says to mom, oh, you're so tired, let's get a night nurse, or I'll take the nighttime stretch. And if mom is going with a newborn 8 hours at night without nursing or pumping and becomes over full, that could over time have a negative impact on milk production, could also lead to blocked ducts and so on, which was our topic last week. And then mom at work, putting off a pumping session. So a lot of times, because I teach the pump talk class here, which is essentially moms getting ready to go back to work, a lot of times people will ask, all of my friends, they went back to work and going back to work decreased their milk production. So there's nothing particular about going back to work itself that decreases your milk production. It's, again, all about the frequency of milk removal. And that's easier said than done. I know in many work settings, it's very challenging to find the time and take the time to express milk. But that's what will help maintain milk production. So most moms, if they're working a 10-hour day or 10-hour separation, 8 or 9 hours at work plus commuting time, will likely need to express milk 3 times during the workday. And if moms consistently skip a pumping session and pump once or twice during the workday, not only will she come up with a few with ounces short for the next day at daycare, but also over time that will downregulate production. So the clock is just simply there to indicate the frequency of milk removal that gets us back to our 8 ball 8 times in 24 hours thoroughly. Now, here are a few physiologic issues that can have to do with milk production, but I just want to point out that although these are all very real, most issues with breast milk production and low supply have to do with the frequency of thorough milk removal, which, as we just talked about, can be from a million different reasons, but the end result is the same. But here are some things that are more primary causes of true low breast milk production. And your own physiology and anatomy, so your breast tissue itself. Most women will find that they have some breast changes during pregnancy. That's a good sign. For women that had no breast changes during pregnancy, that can be a pink flag for breast tissue ability to make a full supply of milk. It's not a given, but it's certainly a screening question that we ask during a consult. People typically notice the breasts are tender, get a little fuller. You can see the blue veins more prominently. The areola darkens. Those are all common breast changes during pregnancy that are very reassuring. We like to see those happen. Breasts typically should feel firm and not very slack and soft in general, and physiologic differences like very widely spaced or tubular breasts are sort of classic pink flags or red flags that lactation consultants ask about. A history of breast surgery, so breast reduction surgery is going to create specific challenges in terms of milk production. Some women with breast reduction will produce a little milk. Some will produce a lot of milk, and that's a special situation that we work closely with moms to help maximize her production. But any kind of breast surgery, like a breast biopsy, for example, is a pink flag, and we always want to kind of watch carefully what's happening. A history of thyroid issues, and a lot of people do have history of thyroid issues, and I encourage you to have your thyroid levels rechecked 6 weeks postpartum. So even if you were taking medication for low thyroid or high thyroid, a lot of times pregnancy and postpartum time frame will change your thyroid levels, so you should have that checked. And then some medications. Now, the mini pill in particular, which is a progesterone-only pill, is not supposed to have a negative impact on milk production, but some women seem to be very sensitive to it, and for some women it actually does. Any medication that contains estrogen, estrogen vaginal creams, an IUD that has an estrogen component, and other birth control medications with estrogen can have a negative impact on your milk supply. In general, lactating women shouldn't be using estrogen. So to increase milk production, which works better, the baby or the pump? And the answer to that is it depends. It depends. So a lot of times people all make pat statements like a baby always works better than a pump. Well, a jaundiced baby who is sleeping at the breast while moving their mouth and making it look kind of like they're breastfeeding is not going to be as effective as a high quality double automatic breast pump. On the other hand, I can and do a whole 2-hour class on pumping and so on, but making sure that if the flanges are not the right size for you, if your technique is not great, if the pump itself is old or not great, that's going to have an impact on how much milk you can remove from the breast. But again, to increase supply, which works better, the baby or the pump? The answer is it depends, and often we will, when possible, use both. So if the baby is nursing and mom is struggling with supply, then is there a milk transfer issue going on? And if so, we have to improve the milk transfer, but also stimulate more supply. Hands-free pumping, yeah, laugh now, thank me later. If you are not pumping hands-free and hands-on and using a hands-free bustier, and I am a huge fan of the Simple Wishes bustier in particular, you're missing out, because hands-free pumping means that you can type, you can tend to your baby, you can eat if you're at work. Hands-on pumping means that you can touch your baby, and you can also touch your breasts, because doing manual compression, massage while you're pumping will maximize the amount of milk that you can express, and new research shows us it can increase the fat levels as well. So here's a great example of a mom. Of course, she's got an older baby here, but she is expressing milk hands-free while she's keeping her baby busy. If you are increasing your supply while working on breastfeeding, it's probably going to be a combination approach. So again, we have to see if we can improve the breastfeeding so that the milk is actually transferring from the breast to the baby, pumping after breastfeeding, because by eking out another drop and another drop and another drop of milk, if the breast has been thoroughly emptied, or I don't like that word, but thoroughly stimulated, that will send that message to the brain over time to increase production. And sometimes, yes, supplementing can be needed. If the baby has not been thriving, the baby needs to eat. So here is the 3-stage approach that is commonly used. You work on the breastfeeding, and sometimes moms just get in way over their head in this scenario, especially if she's trying to do all this by herself and her partner or family member is not around to assist during the day. This can be, over a few days, extremely overwhelming to work on the breastfeeding and then to pump and also to supplement the baby. It's 3 times the work. So work on the breastfeeding. It can be at every feeding, or you may choose to work on breastfeeding at certain times of the day when you and the baby are, in a better mood. And if your baby is essentially screaming at the breast or sleeping at the breast, you don't have to struggle that way for an hour. If you're still going to need to pump and you're still going to need to supplement. So if the feeding is going well, continue. If it's not going well, you spend 5 or 10 minutes, or what feels right to you, working on the breastfeeding, keeping the baby awake, seeing if they're transferring milk. If you're getting too frustrated, if the baby's getting too frustrated and you're still going to need to express milk and supplement, then you can move on to that part. Often the breastfeeding begins to go better as your supply improves. And for babies that are transitioning to the breast after taking bottles, often we like to try to help moms get to a place where their supply is actually about 120% of their baby's intake, because it makes it easier for the baby at breast to do a little work and get a lot of reward for their efforts. So again, working on the breastfeeding, pumping after breastfeeding, and then supplementing if needed. And you can see how Susan here is showing that she can actually combine two of those steps. In the last panel, she's actually feeding the milk she expressed 2 hours ago while she's pumping for the next feeding. Okay. And pumping after breastfeeding, many moms will ask me, how can I do that when the baby wants to nurse constantly and I try to wait for the baby to be down and asleep, but it never happens? That's right. So your baby will either be down or asleep, but the likelihood of them being down and asleep is low. So hands-free pumping so that you can keep your baby next to you and keep them content. And pump right after breastfeeding rather than trying to time it in between two feedings, which often backfires on you. You want to pump as a continuation of the breastfeeding session. And if you are pumping for a healthy baby at home in the community rather than expressing for a preemie in the NICU, there's very specific hygiene protocols that must be followed. In the home setting, if you're pumping very small volumes of milk after breastfeeding, unhook the tubing, stand the bottles all set, just like you see in the picture, up in coffee mugs in the refrigerator, tent a Ziploc bag over them, and then next time you breastfeed, 2 hours later, you can take those flanges with the bottles still attached out of the refrigerator, hook up the tubing again, and pump a second time into the same collection set, yes, on top of the same milk. And so you're saving a lot of time standing at the sink, transferring very tiny volumes of milk, washing everything. I find that usually 2 to 3 days of doing that 6 times a day is enough to make a mom want to give up. So you don't have to make it that hard. You can unhook the tubing and stash your stuff in the fridge and then pull it out of the fridge and hook the tubing up and pump again. You can do that 2 or 3 or 4 times a day after breastfeeding. Okay, so here's a fun slide. Somebody told me I should try, you name it, fill in the blank. So here's some common things that I stuck up on here. Some work, some people think work, some may work for some people, some are safer than others, and so on. Every culture has a list of foods that they think help lactation, and there's a list of foods that they think moms shouldn't eat. In the United States, people will say, you know, moms shouldn't eat, beans and corn and, you know, gassy foods, as though when things break down in your intestines, those little pockets of gas will travel somehow up to your breast and into your nipple and go into the baby. But currently, common recommendations are oatmeal. Oatmeal is very hip right now for lactation. And then there's the lactation cookies. Those are very popular. You know, will those things help? Well, these are nice whole grains that have protein and good calories, healthy calories in them. You know, they're not going to hurt. Certainly, moms need to remember to eat. If you are interested in lactation cookies or muffins, there's a lot of recipes online. It seems to me most of them have to do with being extra healthy or enriched oatmeal cookies or muffins. Typically, they have things like flaxseed oil in them and a few other, you know, types of supplements in them, and they can't hurt. Now, they're not gonna. It's not a, you know, it's not a magic trick that's going to magically overnight change your milk production. There are companies that make lactation cookies, breastfeeding breast milk production cookies, and they're very expensive, but they're tasty. They sent me a bunch, and we all enjoyed them here. And you know, I haven't lactated in a while. My kids are 18 and 14, so it's been a couple of years for me, but they were tasty. And if you want some recipes for lactation cookies, look online. There's a bunch of good ones. And then make sure that you either send them to me, the cookies, or drop them off to me here at ISIS Needham so that I can check and test them for you. So I absolutely do need to test them. Down below is beer. So how many people have been told that, that beer is good for your milk production? Well, dark beer, the kind that a lot of people don't like, do like Guinness, really dark, thick beer, because it contains hops, and hops is a grain. Again, we're kind of getting back to the to the flaxseed oil, the oatmeal, and so on. The alcohol in the beer is actually not beneficial to breastfeeding. Breastfeeding moms can have an occasional celebratory glass of beer, wine, champagne, a mixed drink on occasion, and you don't need to pump and dump. Preferably, if you're having half a glass, a little something, it really shouldn't factor into your breastfeeding. If you're having a good one, you may want to wait maybe up to 2 hours or so before you breastfeed. But the alcohol itself is not going to enhance your milk production, and in fact, alcohol can interfere with your milk letdown. So I put O'Doul's up here as an indicator that that darker beer possibly could be beneficial or not, but it's not the alcohol that helps. So, have yourself an O'Doul's if you want to see if it does help you. A lot of people will say that they've been forcing fluids, drinking tons and tons and tons of water. So I had a mom email me yesterday that said she was struggling with supply after having the stomach flu, and she's been drinking 96 ounces of water a day, but wanted some other information. And, the fact that she came up with a number, a volume of water she thought she needed to be drinking every day, was both a little concerning and a little amusing. But you don't need to force water or force fluids. I myself am a big water drinker. I like seltzer and I like water. I don't drink any diet sodas or regular sodas or juice. I drink water or seltzer or margaritas. But forcing fluids is not going to make more milk, and you actually can overdo it. The key thing is to have fluids available, so whenever you're thirsty, you drink, and to make sure you're on a cycle so that you're very well hydrated. And a good rule of thumb is if your pee is looking like apple juice, then you're not well hydrated. Your pee should be lighter than apple juice. It should be a lighter yellow. If you're someone who knows you should be drinking more water but can't seem to remember to do it, here's a suggestion. Take an 8-ounce plastic cup, like a tumbler, and leave it in the bathroom. And first thing you do when you get up in the morning is fill it up with water and drink it. Because 2 hours later, I guarantee you'll find yourself in the bathroom peeing that water out. And while you're in there, you can drink another big glass of water. So getting into that routine, that cycle of peeing and drinking can help you. But in general, you do not need to force water in there. Being dehydrated will have a negative impact on your milk production, but being overhydrated is not going to make more milk. Now, here's a whole bunch of what's called galactagogues, or over-the-counter remedies to increase milk production. There's More Milk Plus, which is a capsule or a tincture. There's fenugreek capsules, mother's milk tea, Golacta, which is a newer one that's popular. And these 4 things in particular I put up here because I know these products, and in general, they're assumed to be safe for nursing mothers to try. If somebody said to me, I really want to try one of these, it probably can't hurt. It possibly can help, but there's not a lot of research that really proves it does. In particular, fenugreek is probably the most common one that moms I work with will try. And the capsules are 610 milligrams, and typically people will take 3 capsules 3 times a day with meals, and sometimes add 3 more capsules at bedtime, so a maximum of 12 capsules in 24 hours. You'll notice that after the second day or so, your underarms and your urine smells very faintly like pancake syrup. And when you open the bottle of fenugreek capsules and sniff it, it actually has a nice pancake syrup maple fragrance to it. And I would say that about 50% of the women that try fenugreek thinks that it helped a little or a lot. And 50% said it didn't really seem to make a difference for them. But it's not expensive. It's been used for many, many years safely, and you can find these things in places like Whole Foods and natural health stores and so on. Golacta is a newer one. I'm interested in people that are using it to get their feedback. I asked an herbalist friend of mine who's a doctor of osteopathy and a nutritionist and so on, and she looked up the malunggay leaves and told me that women have been eating these leaves in Africa for thousands of years as part of their nutrition. are healthy. So it seems to be a safe thing to try. But I would like to get more feedback before I have any recommendations or not, because it's still relatively new on the lactation radar. So to wrap up, just a reminder, there are many paths to breastfeeding, and think of if you're having challenges, my heart goes out to you, and please think of it as a phased approach. Sometimes the road to breastfeeding is long and wavy, and the most important things are, number one, that the baby is being fed and is healthy and nourished, and then number two, that your milk supply is initiated and then maintained, because then you have, it doesn't feel like the luxury, but you have then the luxury of time to gradually put the pieces of the puzzle together. And it can take days, it can take weeks, and sometimes it can take months. So imagine, a mom whose baby is ill or premature, and her road to breastfeeding starts with a breast pump, and she's expressing milk 8 times in 24 hours, and the baby is first being fed by an NG tube, and then the baby is fed by a bottle, and then gradually the baby begins to have some feedings at the breast, and then maybe even all feedings at the breast, and gradually the pumping is tapered off, and so on. So that's an example of a many-phased approach to breastfeeding. But the baby needs to be fed and healthy, and the mom needs to initiate and then maintain milk production, and then all things are possible. Next week, our topic is going to be oversupply, overactive letdown, and then the dreaded fore milk, hind milk questions. Before people get off the chat, I'm gonna talk a little bit more about this. I'm going to answer a couple of questions. I want to let you know that if you like the chat, please spread the word, because I'm here, I'm talking, whether there's 40 people in the chat room, plus another 30 that are lurkers. If there could be another 100 people here on the chat room, it would make me just as happy to get the information out to more people if it's helpful. I'm on Twitter, I just put my Twitter handle on there. And you can share the link to the chat on any email lists or websites, Facebook pages, and so on. It's every Thursday at 12 noon. We're here, we're happy to support breastfeeding and to support moms who want to nourish their babies. So next week, this topic of oversupply and overactive letdown. It seems like a good problem to have if you're a mom struggling with low supply, but it's hard too. You get a lot of moms who are pump dependent, who are breastfeeding but also need to pump numerous times a day because they end up with engorgement, blocked ducts, mastitis. You have that heavy overactive letdown. You see my fireman with the hose there. The baby on the receiving end of that is not a happy camper. You have the baby that's crying, perhaps a lot of question about what's in the diaper. What about these green, frothy, slimy stool? What about poop that has mucus, or even mucus with streaks of blood? I was told that was a cow's milk protein allergy. My baby has reflux. A lot of those things actually may have more to do with breastfeeding management and lactose overload. Lactose overload is not the same thing as lactose intolerance, and there are not two types of milk, fore milk and hind milk. There's one kind of milk. It's called breast milk. As the feeding progresses, as the breast gets softer, the fat ratio slowly climbs. So the milk that's there at the very beginning of a feeding, that's been sitting in the breast collecting since the last feeding, is a little bit more diluted. So it's higher in lactose and slightly lower in fat than as the breast begins to release milk and drain. The ratio of fat slowly rises. As the milk volume decreases, the fat ratio raises. And so what's left at the end of a very long, good feeding session or pumping session are drops of very high fat cream. And so there's no distinct line between fore milk and hind milk, and I get a lot of questions like, how many minutes does the baby need to nurse before she gets to the hind milk, or how many ounces of fore milk is there for me to pump before the hind milk, and so on, when in fact there's just one kind of milk, and it all blends together and it's all good stuff for your baby. Okay. Whoo, I ignore the chat room, the chit chat while I'm talking. I just, look at my slides and look off at the wall with a glazed expression because there's just so much chat going on and it distracts me. So let's see, let me catch up and say hi to everybody and to Katie. Katie, are there any, do you have any suggestions for me on whose question to take first? I'm going to take a couple of questions. I'm going to read this one. This one's from a mom I met this week, and she said, "This is a great one. We love you, Nancy." Well, thank you. This is actually from a mom and a dad that I met, and a baby who's not born yet. But I look forward to meet when that baby makes his grand escape. I look forward to meeting him. Okay, I'm going to take this one. Hi, Nance. I have a two-part question. My daughter is almost 8 months old. She nurses 6 times a day. Is there a way to wean her down to 5 times? She's eating 2 meals a day. Part 2 is in regards to teething. Her first 2 bottom teeth just came in. How do I keep her from biting? And would it be horrible if I eventually switched to all pumped milk from a bottle? Hey, you snuck in 3 questions. That's a third question. Good for you. I like the spirit there. Okay, so I'm gonna, I was gonna say I'm gonna put on my no judgment hat, but I don't really need to put it on because I try to wear that hat all the time. This isn't a judgment thing. This is what every mom has her own thoughts and her own what she needs to do. And some moms, for a variety of reasons, exclusively bottle feed expressed milk. Sometimes it's by situation, sometimes it's by choice. I want to point out that every single week I get a question about babies and teeth, and so I made a slide. Yay. That's new. That's a new slide. Look at that wonderful slide. So let's take those 3 questions step by step. Your daughter is almost 8 months old. She nurses 6 times a day. Can you move her down to 5 times? She's eating 2 meals a day. Sure, you can. You can do different things. So you could substitute if she really seems to need to nurse 6 times a day. If you wanted to, and moving to the third part of your question, can I switch to all pumped milk and bottle feed the pumped milk instead of breastfeeding? Now, at 8 or 9 months, you could kind of do a combo. And hey, I think that's what I'll suggest for you. What about lightening the load a little bit, and maybe maybe breastfeeding will feel more doable if you also feel like other people can feed the baby. She can have breast milk from a bottle. You're not the only one that can put the baby down to sleep at night. That's a recommendation I have for a lot of you, especially with younger babies, which is begin to separate breastfeeding from the last part of your baby's bedtime routine. It can, number one, help your nighttime sleep. When the baby wakes up, that breastfeeding isn't the only thing that always has them fall back asleep. And number 2, it's very helpful in a breastfeeding family to have the non-breastfeeding partner be able to put the baby down to sleep every night or some nights, so that mom doesn't feel like she's the everything. Well, she is the everything, but still, it's nice if you feel like you can nurse your baby at 7 and then be done for a while, because your partner can take the baby, finish the bedtime routine, and get the baby down to sleep. It can really feel like a nice break. So I think part of my suggestion for you is maybe to pick 1 or 2 of those breastfeedings that you would prefer not to be doing, and those would be the ones that you would then substitute a bottle of expressed breast milk for. And whether you're the one that's giving that bottle or somebody else is the one that's giving that bottle, then maybe you're doing direct breastfeeding 4 or 5 times a day, and the baby is getting 1 or 2 bottles of expressed milk. Of course, you would not be horrible if you chose to only exclusively bottle feed your expressed milk. Some people choose that for a variety of reasons. Some moms travel for business. I mean, if you're not there for 3 days, it's certainly a very beneficial thing that your baby can take expressed milk by bottle. But you're the one that makes that needs to feel like you can make these decisions. And that's what I would suggest, though, is to substitute one of the breastfeedings for expressed milk in the bottle, and have either you or somebody else give it. And then to answer the biting question, when the first teeth come in, usually they are, like you see in the picture, the bottom teeth, and the bottom teeth are a little less troublesome while nursing, because the baby's tongue covers those teeth. But a lot of babies get particularly nippy just in the days before and during the actual teeth eruption. So if your baby is in a nippy phase, be aware of it, keep your eye on it, end the feeding proactively. Typically, the biting occurs at the very end of the feeding when babies are hanging out playing around. So end the feeding yourself as soon as the baby seems to slow down. If the baby does bite down, avoid shrieking if possible. Avoid pulling the baby off the breast, particularly if they did bite down. That could really hurt you. And avoid trying to do something that will scare the baby. So shrieking or yelling no, I actually saw this online once, the recommendation to flick the baby's cheek with your finger. None of those. I would recommend none of those approaches. Instead, take a deep breath so you don't shriek, and then press the baby's head firmly into your breast tissue so that your breast is covering their nose and their mouth, and they will promptly respond by opening their mouth to breathe, and then you promptly take them off the breast and calmly but firmly say no. No biting. Biting hurts, mom. And then you can end the feeding. You can try again if your baby's young, or you can end the feeding. For an older baby, you do the same thing, but sometimes you take the additional step of putting the baby down on the floor and walking away. And especially if it's a toddler, they don't find that amusing at all. Okay, I see that it's after 1. I see my laptop battery is low, and I see it's time for all of us to get back to our real jobs. But I really appreciate that you took the time to be here, and I hope that you learned 1 or 2 things that were helpful, and I would love for you to put this on your calendar and come back next week. And as I said, I'm going to come back to that slide. Next week, the topic is going to be oversupply, overactive letdown, formula kind milk issues, and general questions. And follow me on Twitter, and I'll follow you on Twitter. And thank you so much, Katie, for moderating today. Oh, and hey, you know what? We have a baby skin webinar this Friday evening, along with Dr. JJ, pediatrician and dermatologist from MD Moms, and I'm going to moderate that chat. So I don't know if Katie has the link to that, but I can put that link up too. And the other thing to let you know is all of these chats are now recorded. So in a couple of days, this link to this chat will be on the main breastfeeding chat page that you click through to get here today. But you can find the chats from the previous weeks. Last week we did mastitis and block duct treatment and prevention. The week before that I did breasts, babies, and bottles, feeding the baby while preserving the breastfeeding, and so on. So you can always refer people to those or look at those on demand at your leisure. Have a great week and happy nurturing, everybody.